acute abdominal pain, vaginal bleeding, abdominal vitals, blood oozing, left brow being right fallopian tube, hemorrhage and rupture. What is the diagnosis? And the diagnostic cause of the hemorrhage. Very easy. 34-year-old woman, beta thalassemia major, 2-month history of fatigue, cracking in the skin, pain in ankle joints, thirst, urination for 2 weeks, gets blood transfusions every year. Victorious, pale, enlarged liver. What is this? Iron. She's getting lots of blood transfusions every year. Too much iron means elevated ferritin. 72-year-old man, fatigue, weight loss for 6 months, medications. Splenomegaly, lymphadenopathy, stone tender, which is bad. Peripheral smear shows abundant smudge cells. So diagnosis. Smudge cells. Yeah, the only thing associated with smudge cells on exam is CLL, which is chronic lymphocytic leukemia. So this is a keyword. If there is no other keywords, you should still get it. Any old person with lymphadenopathy is non-tender, CLL. Bone marrow or AML, just we have fever, cough, irregular interstitial infiltrates, enlarged and prominent intranuclear lesions. What causing it? What happens when you get a bone marrow transplant? Means you have no immune system, so you can get infected easily by common things like what would be in the bone marrow. So infections after bone marrow transplant, it's a virus that causes prominent intranuclear lesions. That's you don't need the choices, right? You can solve it without choices, just like the real life. 30-year-old man, follow up after a chemical burn. Physical shows hyperextension of the hand, the wrist, tense, thick, scar, reduced range of motion, contractures due to what cell? If you burn your skin and get a contracture, what cell is responsible? embryonic clusters and neutrophils associated with what condition? Both elbows. If you have a rash on both elbows, what is it? You said psoriasis, and psoriasis is what? That's why that's one. Seronegative, spondyloarthropathy. Only difference, there's no silvery scale, but it's still psoriasis. 78-year-old man dies from acute kidney failure, yellow swollen. What's the underlying mechanism? What's the underlying mechanism for death of the kidney? Choices. Why? Because you have no oxygen. If you have no oxygen, the pump doesn't work, and you swell up. "61-year-old farmer, 3-month history of cough, dyspnea, weight loss, smoking, no alcohol, clubbing, respiratory crackles, bilateral reticulonodular masses, interstitial fibrosis." What's the underlying mechanism? You should have seen this question before. So what was the answer? It's almost the exact same. What is it? What's the diagnosis? It's pulmonary fibrosis, interstitial fibrosis. Which interstitial fibrosis of farmers? Which one do they get? Farmers get exposed to lots of chemicals sometimes. It makes them hypersensitive to certain pathogens. So it's hypersensitivity, pneumonitis, because of the T cells. So remember the farmer, the interstitial fibrosis, it's going to be hypersensitivity. 62-year-old man has to frequently urinate many times, difficulty initiating the stream, ERP, enlarged prostate. What's the complication? What's the complication if you can't empty your bladder all the time properly? inflammation, kind of goes back to your kidneys. Sixty-year-old man, 6-month history of epigastric pain, weight loss, bloated, anemia, blood positive, ulceration. Biopsy is most likely to show what? What will the biopsy show? So it's a man with a history of pain, weight loss, bloating. There's a big ulcer in his stomach. It bleeds out mostly, causing his anemia. And the most common type of stomach cancer would be adenocarcinoma. Four-month male infant, scrotal swelling, non-tender, that transilluminates. You've seen it before. Hydrocele is good too. Which one? Lactic process vaginalis. 13-year-old rash that's itchy. She has epilepsy. Treated with triggering immunizations, fever, edema, morbilliform rash. So what does she have? Could it be? Yes, grafting to the lamotrigine. Allergic to the lamotrigine, or the side effects of it. Causes an interstitial, lots of reactive. 48-year-old woman, mass left breast, rapidly increasing in size, 6 cm, multinodular. Leaf-like. So it's automatically lotus or phloides. 10-year-old girl, dyspnea, wheezing, large mucus plug for 7 years. Christian spirals. What's the diagnosis? Eosinophils. So eosinophilia, what does she have then? Eosinophilia with dyspnea and wheezing for the past 7 years, with no fever. Should have seen that question before. 30-year-old woman, final history, increasing abdominal girth, pelvic discomfort, metatherian mass, thick, slimy fluid. Mucin-producing noitibia invasion was the feature. Mucinous ovarian tumor with no atypia or invasion is a mucinous cystadenoma. And the mucinous what makes it unique. So serous, when it grows, it's a big balloon. But mucinous, when it grows, what's the difference? Mucinous tumors have multiple locules, septations. So in the ultrasound, multiple septations. When you cut it open, it's like cheesy, like Swiss cheese. But with serous, it's like popping a balloon. 45-year-old man, numbness, tingling, fingers and toes. Hemoglobin low, difficulty with balance. What is it? It's not ALS. Their fingers and toes are tingling, that's called. It's called peripheral neuropathy. When you lose your balance, that affects which one? Posterior columns. Homocysteine methylmalonic or elevated, which means hypersegmented neutrophils. Deficiencies, they give them some B12, cobalamin. 33-year-old woman, lump in the right breast, 15 years ago, had osteosarcoma, coronado, shows it's adenocarcinoma. So what gene is defective? Previously had osteosarcoma. Parent had adrenocortical carcinoma. The breast has adenocarcinoma, which is mesoductal. So what gene? Why? So she has osteosarcoma. The most important, P53. 60-year-old man, health checkup, osteoarthritis, taking lots of painkillers. Eosinophilia, protein in the urine. So what's the diagnosis? What happens when you take high doses of painkillers that are over the counter? ibuprofen, Seconolone, destroy the kidney. 87-year-old man, urine bladder disease, ardent, deformed valve, expires, mounted masses on our surfaces. What's the diagnosis? Recognize cancer, you need to answers to show up first. 5-week-old male infant, 4-day history, recurrent non-bilious vomiting after feeding. 2 significant epigastric grounds. What does he have? What's the diagnosis? Usually it's a firstborn male. Firstborn male infant. You feed him and then he vomits and you feel the abdomen. It's a mouse. Classic case. Pyloric stenosis. That's pyloric stenosis, and then treated with surgery. It's a very classic case. It's always going to be asked. 49-year-old man, severe chest pain, 5 months prior, chest discomfort, and then progressive, has diabetes, 25 pound years of smoking, family history. Lab results are all normal, so became unstable, so he's close to getting a heart attack. He's almost to the point of having a heart attack. 38-year-old woman, 3-month history of bloody discharge from the right nipple. Family history of cancer. Express serosanguinous fluid in the right nipple. Ultrasound shows a single dilated duct. What's the diagnosis? What's it the name? Dilated duct. Switch it around and make it sound medical. What's the medical term for dilated permanently? Ductation. Ductation plus papilloma and grows within it, stretching it. £62 bruising, lost weight for 4 months, weight loss, pallor, bruising of the upper and lower extremities, splenomegaly, anemia, thrombocytopenia, hair-like projections, to show what? So what's the diagnosis? Hairline projections on the abnormal parasites. Hairy cell leukemia, and then on the bone marrow. Tartrate resistant acid phosphatase or TRAP. Falls to the ground. You should recognize this one. RCT cells, yields rush of air, and class event. Recognize it? Falls to the ground and then gets this chest pain. Then there's a breath sounds absent, and then inside the shift, and move feet. There's a gush of air. If I see one ruptured and produced what? And that if I see one ruptures, causes what? No price. So you had people pour out, so the treatment is to remove the air. 45-year-old man, hematuria, bilateral flank pain, urinary stones. There's fever, hypertension, creatinine is high. What does he have? Yes, your current UTIs, the man, your current UTIs, there's something wrong with the urinary tract, right? Kidney failure, all that kidney failure and underwent kidney transplant. So it's significant because of his father had kidney failure and transplant. bodies, remember? You explained it so well during SGD, right? Last year. 23-year-old woman, 8-month history of weakness, burning pain in her neck, shoulders, and arms. After one vehicle collision, and kind of recognized this question from a few months ago, right? So what is it? Is it cake-like distribution? Hypertension, headache, diaphoresis, palpitations. How would you diagnose pheochromocytoma? How do you diagnose pheochromocytoma? Diagnose pheochromocytoma. Urinary metabolites. Urinary DNA. Others also. 55-year-old woman, 6-month history of shortness of breath, exertion, fatigue, diabetes, hypertension, cholesterol, chronic kidney, just every disease as the cause of your symptoms. The cause of her symptoms. She has all of these diseases. Underlying cause. So she has chronic kidney disease, and she has anemia. Anemia means all these symptoms. 66-year-old woman, crushing sternal, chest pain, nausea. We gave her TPA, oxygen, morphine, chest elevation, catheterization. Initial eyes, hemopericardium. At what point in time was that infarction? Point in time is the infarction. Should it make choices? The clue, the main one, is elevated troponin. Take a second. 7-year-old man pressed the march bilaterally, not obese but taking medications, widely habit. That's the most likely explanation for a man with bilateral fasciculation. Choices? Most likely. Most likely are breast counts. It's the most likely cause of gynecomastia. How common is it here that people drink alcohol? There's lots of alcohol drinking, so cirrhosis. If cirrhosis is bad enough, it leads to what? Why does cirrhosis lead to gynecomastia? Estrogens don't get degraded by the liver, so there's plenty of estrogen going to the breast. 5-year-old boy with testing reveals abnormalities that inhibit cilia, the normal function of cilia. What is it? Very easy, remember it. 68-year-old man, 6-month history of difficulty swallowing. It's worse. Barium swallow shows accumulation in the posterior pharyngeal wall. What is it? Bird's beak sign. If it doesn't have appellation, there's a non-pouching in your throat, an out-pouching. Yeah, Zanker. Causes Zanker diverticulum. Pressure. You squeeze too hard into diverticulum. 60-year-old man, dyspnea, diaphoresis, chest pain, dilates, elevation, troponin, to diagnosis. Acute MI, ST elevation. Multiple raised lesions on the shaft of his penis, on the number. sphenomegaly resulting from urinary obstruction. 1-year-old boy, older sister had eye disease requiring removal, white reflex. So what is it? It's a diagnosis. If you see a child with a white reflex in their eye, what's the diagnosis? White reflex in the eye of a child. What is that? And that sister already had the eye removed. What is it? Retinoblastoma. So we have increased risk of what? Osteosarcoma. They lost which gene is affected? RB. They lost the RB gene after the 2 hits, right? 34-year-old man, 6-month history of epigastric pain, heartburn, no relief, diarrhea, elevated gastrin. This is another SGD case. This was an SGD case. Remember last year, talking about gastrin. On the left arm, heart failure, and heart transplant, cyclosporine. We have root vesicles on an erythematous base, a dermatomal distribution. What is it? That's all the clues you need. Root vesicles on a dermatome. In someone who has no more immune system because they had a transplant. Diagnosis. What's the diagnosis? Varicella zoster. This is zoster. It's a shingles. So you should know shingles, okay? G2, unconscious, postpartum course complicated by severe bleeding, blood pressure is low, glucose is low, TSH, thyroid hormones are low, sodium low, so everything is low. What did she have? Did she have, include she as part of Hand syndrome. Chest pain, worse system deep inspiration, it proves to leaning forward, diffuseness, the elevation, and heart attack 3 weeks ago, fever, pressures, pleural effusion. What's the cause? Worse sense of deep breathing, improves with moving forward, it's pericarditis. Since it's after a heart attack, what's it called? Pericarditis, Dressler syndrome, and that's Dressler syndrome caused by what? Caused by? It's the cause of Dressler syndrome. It's immune response. Suddenly, like a learner to history of severe muscle amounts of pain. It's homeless. Calcium, glucose is up, creatinine up, sclerosis, radiolucent bands. What's the explanation? There's hypertension, anemia, low calcium, phosphorus, high glucose, kidney failure, alternating sclerosis in the bones. Kidney failures, just losing calcium, so parathyroid tries to compensate. 24-year-old woman presents with restlessness, feet intolerance, palpitation, thyroid enlargement. What happens if you go on an alcohol binge? You can have acute pancreatitis, and without findings of acute pancreatitis, might pay. history of first and gastric pain, weight loss, painful red nodules in right calf, large mass in the gastric antrum, mucus secreting adenocarcinoma. Where did they originate? It's a tumor. Where did the cells originate? Versus from the stomach. 67-year-old man, 2-month history of fatigue. He's pale, pinpoint red, non-blanching spots, splenomegaly, anemia. Leukocytes are very high, platelets are low. Immature cells with prominent alveoli and pink, elongated, needle-shaped cytoplasmic inclusions. It's a diagnosis. Just pink, elongated, needle-shaped cytoplasmic inclusions. Those are called outer rods. Genes may have so if you see outer rods or the description of outer rods, that's automatically AML. 27-year-old woman, third trimester, upper breast. After birth, it disappears. It's a diagnosis. So lump is 2cm, freely movable, and disappears. So what is it? Breast mass, reproductive age, female, movable, firm to rubbery, round. What's it called? Fibroadenoma. It grows during pregnancy and shrinks after pregnancy. 35-year-old woman, 3-month history of fatigue, showing stomach pain, acromegaly, nodules on her shins that are purple, indurated, into full cheeks, liver biopsy shows star-like pattern. What does she have? You don't recognize the question? So she's 35, fatigue, shortness of breath. She has this rash on her shins, lesions on her nose. Sarcoidosis. Four-year-old girl, physical exam, abdominal mass towards the right flank. Solid right kidney, not infiltration of the renal vein. Solitary mass confirmed, pseudocapsule. find in the genetics. So the almost only renal tumor in children is renal tumor in children. The main one is, starts with a W, nose tumor, mostly genetic abnormality. And 14-year-old boy, smoky urine, facial puffiness, had a sore throat 3 weeks ago. Lots of bad findings. So, bad findings and incidents. What's the diagnosis? He had a sore throat 3 weeks ago, he didn't get treated. Now he has smoky urine, puffy face, post-trap, glomerular nephritis, what you expect to see, labs, streptozide. This is cross reaction. Fifteen-year-old girl, painless swelling under her left lower jaw for 5 months. Sister had ALL, no fever, with a swelling, 4 cm below the base of the mandible and anterior to the sternum by a mastoid soft fluctuant. Doesn't move with swallowing or exhalation. Round, uniform, low echogenicity, presentations. It's a diagnosis. Brachial cyst. So if it was in the center, it would be. If it's in the midline, it would be thyroglossal duct cyst, but since it's a lateral, brachial duct cyst. 67-year-old man, weight loss, non-smoker, not tender, lymphadenopathy, multiple nodules in all lung fields. What could it be? Yes, cancer and spread to the lungs. Multiple nodules all over the lungs. It's probably cancer. 33-year-old woman, hemorrhagia, increasing fatigue, hypochloremic anemia, enlarged uterus, regular masses, sharply circumscribed, composite smooth muscle. What is it? What is it? It's the most common tumor in women. Myeloma. You have decreased blood pressure with increased pigmentation. What does that tell you? Decreased blood pressure, but you have darker armpits and neck. It's failure of the adrenal cortex. They're not making any more aldosterone or anything useful. 8-year-old boy, 3-week history of irritability, bedwetting. Unable to look upward without tilting his head back. Dilated pupils, not reactive to light, bilateral optic disc swelling, Tyler 2. What's the cause? Can't look upward. So he tried to move your eyes up and do it right, but he can't lift his eyes up. He has to really move his head. If you can't move your eyes up, that's cranial nerve. 3. So what is around cranial nerve 3? Midbrain. The more anterior part of the midbrain, there's parts of cranial nerve 3 there. And this pineal tumor will compress the nerve slowly, so that only part of cranial nerve 3 works. And it's not reactive to light, that's cranial nerve 3. A 24-year-old man, non-productive coffee relays, late light adenotasis, cold agglutinins. What is occurring? Cold agglutinins. If you see cold agglutinins, Mycoplasma pylori. 50-year-old male with melanoma hasn't spread. Which of the following is most likely to negatively affect the prognosis? What will worsen the prognosis of melanoma? Which one versus prognosis of melanoma? Melanoma on your fingertip versus melanoma on your chest. Fifty-year-old man, 6-month history of pain, nausea, vomiting, diarrhea, weight loss, bilateral pitting, fetal edema, chronic rugae, varicose cell atrophy. So what's the cause? It causes prominent rugae in your stomach. And what would cause parietal cell atrophy. That's retinitis plastica. So 68-year-old man up in his left axilla, varies over time, other masses in the right spreads. There's a similar one in his right groin. Spleen is palpable. He has T14-18 translocation. What does that mean? T18 translocation means radicular fallen. Eighteen-year-old woman, history of swelling right side of the face, smoker. There's a mass. So 3.3 cm sharply demarcated, rising from the product gland. There's a capsule. There are epithelial cells with a chondromyxoid stroma. Diagnosis is diagnosis. The most common salivary gland tumor is pleomorphic adenoma. Investigator processing blood from a human. It's something designed to break hydrogen bonds, and it's cooled. Enzyme is derived from Thymus aquaticus. So what is this lab procedure? You should all know this lab procedure. Force a lot of us to do it. Yeah, it's PCR. You split, or you unwind the DNA, cut it, replicate it. 18-year-old female, febrile, hypertensive, untended, petechial, gram-negative diplococci. What's the diagnosis? What's the diagnosis? Frederick. 25-year-old woman last trimester. Blood pressure is high. She has proteinuria. What's the most dangerous complication of preeclampsia? Most dangerous complication of preeclampsia is UIC. 42-year-old, 7th-month history of diffuse weakness, chest X-ray, anterior spinal. So what does he or she have? Anterior mediastinal mass. And weakness. So remember in myasthenia gravis case, and then at the end of the case you go to the underlying cause is what? Produced by what? Antibodies produced by anterior mediastinal mass, which is lymphoma. Eighteen-year-old woman, intractable vomiting, and uterine cramping. HCG is very high. Complex intrauterine mass with multiple ovarian cysts, ectopic villi, karyotype will show what? It's a diagnosis. What would cause a very high HCG? Mold. Iodotiform mold. So is it a complete mold or incomplete mold? Recognize it? Four-year-old girl, painless lump in her neck, swelling below the level of the microphone. And also 54-year-old woman, 3 weeks after MRI, sharp pain, sweating, hypotension, and dyes, ventricular rupture. Is the cause of death? Autopsy showed ventricular wall rupture. How did he die? When your heart ventricular wall ruptures, what will happen? If someone stabs you in the heart and pulls out the knife, what will happen? Tamponade. That will cause tamponade. So if they stab you in the heart, you really should leave it there. Because once they pull it out, it will bleed, tamponade, and then that's it. The time is at an end. 11-year-old, periumbilical pain. Massive tissue seen in joining the inferior pole of both kidneys. What is it called? Two kidneys join at the bottom. Horseshoe. What's the problem on the horseshoe kidney? UPJ obstruction. It's not formed properly, so it kind of kinks, and then there's obstruction of the nerve. 52-year-old man, painless right-sided scrotal swelling, started weeks ago. HCM soft cystic not tender, transglutamates. Does not reduce when the patient is supine. What is it? It's not A. It's not B. It's not C. It's hydrocele. It's also hydrocele, but it's not connected. "51-year-old woman, 3 months history fatigue. Depression. Blood pressure high. What cell, when hyperplastic, causes your symptoms? Do you know it? You know what she has? What happens when you have hypercalcemia for a long time? Hyperparathyroidism for a long time, what you get? Stones, moans, or psychic moans and groans, depression. What cell? You sure? Machine cells. Hyperparathyroidism of any type will cause hypercalcemia. With hypercalcemia for a long time, you get kidney stones, and you get depressed, and you have constipation because the calcium does what? Hypercalcemia in the cause. Muscle contraction causing the constipation. 45 milligram palpable mass of the right thyroid. It's non-tender thyroid nodule, normal thyroid function, elevated calcitonin, medullary thyroid carcinoma. What histologic features are special of medullary thyroid carcinoma? What's special about medullary thyroid carcinoma? Medullary causes amyloidosis. Orphan Annie is papillary lymphocytic Hashimoto. Some of the bodies papillary. 66-year-old man, rough skin over his forehead, back of his hands, two erythematous papules, many textures, central scale. So what is it? It's a diagnosis. Back of his hands and forehead. Just put he's a farmer also. So what does that mean? Farmers are exposed to the sun. So which one is this? Which one has a gritty texture? The central scale. Well, the diagnosis is not here. The diagnosis would increase its risk of which one? This cell, so what does he have? Actinic keratosis. So he has actinic, and then if it progresses, I'll go to squamous. So female newborn, rapid breathing, grunting, subcostal retractions, dies. Bilateral renal agenesis is the cause of the respiratory distress. If the baby has no kidneys, why does the baby have respiratory distress? Swelling, non-small form, and then without kidneys, we have less amniotic fluid. 58-year-old man, 3-week history of painless growth in his mouth. About 38 years. Socially drinker, white patches, HIV negative. So what's the diagnosis? White patches in your mouth with HIV negative. It's just leukoplakia. If it's Epstein-Barr and it's carrying leukoplakia. And if it's HIV positive, which will lead to Epstein-Barr. 58-year-old man has hypertension, diabetes, lower lip lesion, he smoked, farmer, ulcer near the Vermilion border. So diagnosis. He's a farmer who likes to smoke, so he's exposed to lots of sun and cigarettes, and now he has an ulcer on his lip. An ulcer on the lip. Basal cell happens over here. So what's this? Squamous cell. 34-year-old woman, weight gain, irregular menstrual periods, increased hair, elevated BP, sugar, stretch marks, smooth, lesion on the left adrenal gland. Okay. Shape of rolling parts. Joel's health. So we have coronary artery bypass and going into the blood vessels. And sometimes you break pieces of the atheroma off, and they embolize into the brain. That's embolism. And coronary diarrhea, fatigue, bloating, weight loss. So, villus flattening, lymphocytic infiltration of the mitochondria, what is going to improve the symptoms. malabsorption. That's it. Celiac disease. Just avoid right there. 76-year-old woman, 3 months vulvar itching and pain, lichen sclerosis, smoking history, ulcerative lesion on the vagina, intraoitus, squamous cell carcinoma, enlarged lymph nodes. Which lymph node region is most likely going to metastasize to first? In middle. 75-year-old man, thickening of the fascia of one palm, contracture, 4th and 5th. What's it called? What's that called, the 4th and 5th contracture? You have to put tread. Put tread. 28-year-old woman, G2P1, 30 weeks gestation, has headache. So we have elevated blood pressure, pitting edema, urine protein. So what's the complication of that? Just hypertension. What would the hypertension cause? Central eruption. Fifteen-year-old boy, mucocutaneous neuromas, morphoid habitus. Sure. Two-year-old boy, mass in the right testicle, orchiectomy, Schiller-Duval. What serum marker is most useful in Schiller-Duval tumors? Multi-organ failure. For classification of all lung fields, what is that in her lungs? Opacification, total whiteout of your lungs. What is it? TEAD, diffuse alveolar damage, or acute lung injury, respiratory distress syndrome, all the same. 65-year-old woman, difficulty hearing, hip and lower back pain, impaired hearing with whispered voice, lateralization to the right, local tenderness in the right hip and groin, protein is 6.5, which is high, alphos increased, calcium, phosphorus. What's the mechanism? Choices? Which bone disease will affect the hearing? Remodeling. So cytokines on the B cells. Which cytokine is responsible for certain changes in B cell function? Which cytokine has B cells produce an antibody that prevents attachment of pathogens to mucous membranes but does not fix complement? What does that mean? What antibody prevents attachment of pathogens to mucous membranes and doesn't activate complement? It's IgA. So what cytokine leads to IgA? What cytokine makes you produce IgA? Thirty-five-year-old man, acute chest pain, nausea, ECG, shows MI, he dies. Which disease did the patient have? Twenty-year-old man, dark urine, decreased fluid output after skin infection. We're getting finished with antibiotics, of course. Blood pressure high, edema. So what will you most likely see? Post-strep. Post-strep. Streptozyme and anti-DNAs. Forty-one-year-old woman, dyspnea, palpitations, edema, flu, muscle pain, cardiomegaly, deep pulmonary edema. She dies. Diffuse interstitial mononuclear inflammatory infiltrate. What's the diagnosis? She had dyspnea, palpitations, edema, flu-like symptoms. So she suddenly had irregular heartbeats. You don't suddenly get irregular heartbeats. That means there's inflammation of the heart. There's inflammation of the heart. It's very bad because suddenly it can go to deep fib and then that's it. So she has some heart infection or inflammation, and biopsy shows interstitial mononuclear inflammation, which means lymphocytes. And it was probably any type of virus, so it's just unlucky or predisposed. 17-year-old boy, sore throat, cough, bloody urine, had previous episodes, fever. We have red blood cell cast, biopsy will show blood. What does he have? It's not post-strep. There's multiple episodes of sore throat and cough. So it's not crescent because we'd be dead, within a year. Wire looping? No. Is it something with SLE? No. Is it minimal change? No. It's IgA nephropathy. So they get coughs and colds, and then they start having bloody urine, then they improve, and then it happens again, and improve, happens again until it doesn't improve anymore, especially for adults. But in children, it just improves and then goes away when they're treated with steroids. 52-year-old woman, 3-month history of progressive abdominal bloating, satiety, pelvic pain, weight loss, invasive ductal, bilateral ovarian masses, ascites, metastatic adenosine, was the most likely primary site. Breast, really had breast cancer. A 23-year-old woman with routine health. She has intermittent dry cough, recurrent hoarseness, mass projecting across the right high lung confirms a well-defined mass in the posterior mediastinum. What is it? What could it be? Posterior mediastinal masses. Obviously, aromas, gangliomas, and just hard to reach tumors. 41-year-old woman, prenatal care. HCG is very high, grape-like tissue. What's the diagnosis? Which one? Corium. The grape-like tissues. Corium. If it's not malignant, it'd be H. mold, but here it's invading, so it's corium. 62-year-old man, girth, fatigue, peripheral edema, hemorrhagic ascites, enlarged right heart, interstitial pink, and amorphous deposits. This is the diagnosis. Pink amorphous deposits in the heart. Amyloidosis. 63-year-old woman, 6-month history of pain, stiffness in the fingers, worse at the end of the day. Narrowing of the IBJ, sclerosis. What does she have? Also called osteoarthritis. Three-month-old boy cannot find it on his testicles. What's the diagnosis? To our KSM. 61-year-old woman, 5-month history of numbness and burning sensation in both feet, diabetes, cholesterol, HbA1c is high, decreased sensation, ulcer on the left foot, intact pulses, also pathogenics. Hyperglycemia. 25-year-old episodic bleeding from nose and gums and urine. blood transfusion. How do you reduce CMV infection? Reduction. CMV is reducing species. Remove the white blood cells and then less chance of CMV. It would radiate for any other lymphocytes that kind of snuck in. 37-year-old woman with dyspnea for 8 years. Flattening of the diaphragm, hyperresonance, on the right heart border, attenuation, but not findings what she had. She's 37, that's kind of young to have pulmonary disease, COPD, emphysema. It's very young, so it's more likely she has alpha antitrypsin. Last question. 4-year-old girl, heart murmur, right to left atrium. Did you all pass? Were you able to get 70, above 70? There's some changes, of course, but it's from the same question bank. And almost the same distribution, same style, so you should be able to pass. Not exactly the same. Same style, not exactly the same. Mostly it's, I pasted, ChatGPT, change it up a bit. Any other questions? You print already sent me the print. Oral exam? It's like most of you pass, so what's the point of writing that letter? What's the point of writing that letter, that request letter, when most of you would pass? It's like almost all of you would pass. It's kind of hard to write a letter and send it. And all of you would almost pass. Okay? Yes, that's it. See you on Monday.